The diagnostic criteria for DID, according to the DSM-5, is that an individual has two or more distinct identities or personality states, which in some cultures can be described as an experience of possession. The discontinuity of sense of self is accompanied by alterations in behavior, mood, affect, consciousness, cognition, perception, and/or sensory motor functioning. These signs and symptoms can be self-reported or observed by others. The individual has the inability to recall important personal information that is too extensive to be explained by ordinary forgetfulness. This can include traumatic events. The symptoms can cause significant distress and impair functioning in social, occupational, and other important areas of functioning. The disturbance is not a broadly accepted cultural or religious practice, and it is important to note that in children the symptoms are not better explained by imaginary friends or fantasy play. The symptoms are not directly related to the physiological effects of substance use, such as chaotic behavior or blacking out while intoxicated, or related to a general medical condition such as partial seizures. The main changes that were brought forward in the diagnostic criteria between the DSM-4 and DSM-5 is the addition of a cultural and religious aspect, the recognition that the symptoms can be self-reported or observed by others, and the addition to the amnesia criteria that extends to forgetting traumatic events as well. Dissociative symptoms are usually divided into two categories, positive and negative. With positive symptoms, an individual can experience involuntary intrusions of awareness and behavior, such as identity fragmentation, depersonalization, and derealization. Depersonalization can be described as an individual feeling detached from their own body, senses, and feelings, feeling as though they are an observer of their own life. Derealization is similar to depersonalization, however, the individual feels detached from their surroundings. With negative symptoms, an individual can experience the inability to control mental functions or access important information, for example, amnesia, aphonia, and paralysis. Individuals with DID can also present with depression, anxiety, substance abuse, non-suicidal self-injury, suicidal behavior, aggressive behavior, irregular sleep patterns, hallucinations, and emotional dysregulation. Unfortunately, in some cases, these conditions or symptoms that an individual presents with can also mask DID, making it difficult to recognize and diagnose. As previously mentioned, dissociation can be a method of coping for individuals who have experienced a traumatic event. With the link to traumatic events and DID, there can also be the presence of post-traumatic symptoms such as nightmares, flashbacks, and increased startle responses.